Welcome to eSource Home Healthcare Partners' first line of learning and education. I'm Wayne Basil, co-founder and president of Home Healthcare Partners. My co-founder, Cheryl Basil, and I started a little over 5 years ago in the fall of 2003. The idea at that time was to pull together high-quality home health care agencies under one banner, find their greatest strengths of each, and migrate those strengths each to the other, making each one stronger than it had been and the whole far stronger than any one of the parts. That was the philosophy, and we still carry that attitude and philosophy forward. Now we'll take a look at our geography, our office structure as we are today. The slide before you shows our coverage of Louisiana, which is virtually the complete state, large parts of Central Texas, and the Dallas-Fort Worth Metroplex. 34 offices delivering care to something more than 3,600 patients on any given day. We recognized early on that healthcare would be changing dramatically in the years coming, and so we hurried to get the base strongly in place so that we could begin first improving service quality and then second, systems. Vital Partners 365 is the most important new clinical service that we've inaugurated since Home Healthcare Partners was founded. We started this service 3 years ago as a way to find out and prove to ourselves whether or not we could truly reduce the rehospitalization rate of chronically ill patients. The blue bar in the chart you're looking at shows those patients chronically ill who we did not monitor. And over the same period of time, the red bar depicts those who we did monitor. We monitor their vital signs on a daily basis, we coach them on a daily basis, and you can see how much we've been able to reduce rehospitalization rates. In so doing, we have reduced the stress level of the patient, the stress level of the family, and we've saved tens of millions of dollars for Medicare, making this a true win-win-win service. Our systems reengineering project was kicked off into high gear early last year. We developed a data warehouse, which we call the Cube. The Cube gathers into a system of servers all of the clinical and accounting information that we generate every day from every office. By having the information so configured, it becomes extremely easy to build reports. What you see before you is a slide that shows a handful of reports, while in reality we've developed well over 100. They're easy and quick to build, 10 to 15 minutes per report. Once built, the information is refreshed every hour, and the reports can be accessed in only 4 to 5 seconds. Wow, life made over. Once the Cube was in place, we were able to develop other systems to make life easier for all of our team members in the field. The first of those is MapU. This is a scheduling system. This technology allows us to look at each individual field office. You see one before you now. Take a look at the patient geopattern of one office, and you can see how complex must be the job of routing our caregivers to their patients each day. Keep in mind, it's made more difficult by the fact that we're adding new patients on a daily basis, and we're discharging some patients, so the pattern changes. And we're growing the territory of each office, which makes the whole job of scheduling geometrically more difficult as we grow. With this program in place, we can drill down to the location of each caregiver. We can route that caregiver to the visits scheduled for the day, show the most efficient routing, and the distances between each turn. This makes the job far easier for the caregiver, and yes, it makes the job far more affordable. And let's not forget the Z cars. The idea was to provide cars to our clinicians so that we would reduce the carbon footprint of our company and reduce wear and tear on their personal cars as they travel many miles each day. These cars will travel 1 million miles next year and be seen by tens of millions of eyes. Then we really moved into high gear with our engineering project. we developed the electronic pen point-of-care device system used by the clinicians in the field. We knew we needed to develop an electronic patient record. This was our answer. After looking at laptops, notebooks, and the other kinds of devices that are in the field, we decided to go the old-fashioned way with pen and paper. Except that this pen is different. It remembers everything it has recorded during the day. Then at night, after the workday, it's docked, and automatically the data recorded during the day is uploaded to our servers, where it is immediately available to coders, to billers, available for electronic filing. And one of the best things about this pen is that it's inexpensive enough to be provided to our full-time clinicians, our part-time clinicians, home health aides, even contract therapists. That means our electronic patient record is a full and complete record, not just a partial record with selected information. We've added several more programs that we won't go into, such as budgeting, planning, online supply management, but one we will touch on just for a moment is the learning management system that you are now using, eSource. Let me introduce to you two of the people that work with us on this program, Suzanne Merrifield and Susan Crosby.
Welcome to eSource.